So today we're going to see about parasitology. Ancylostoma duodenale. It is a hookworm and it is the second most common helminthic infection in the world. It is the important cause of iron deficiency anemia. I'll tell about in the end. So classification. Hookworm are two types. Ancylostoma duodenale is also called the old world hookworm and Nectarus is a new world hookworm. So here the only host is humans and the happy diet is jejunum. So we'll see about the morphology here. So morphology of an adult worm, they'll be cylindrical and they'll be pink and or grayish white. Most of the worms will have this character, pink and grayish white, but appear to be reddish brown due to ingestion of blood. So these are hook like structured. So these go bind to the mucosal layer of the intestine, which causes excessive bleeding. So that even eventually causes this iron deficiency anemia. So because of that, this worm is also becoming reddish brown in color. So and then next point is prominent buccal cavity. So they have like a chitin like structures, like they have six teeth. They have four hook, like ventrally they have four, and median cleft dorsally. Ventrally they have four hook like, so they get attached to the mucosal layer. They have four and two, 4 plus 2 is 6 teeth. So this is the adult, and this is female worm is larger than the male worm. Anterior part has the esophagus, buccal cavity, postulatory structures, and vulva is in the posterior end of female. So this is about the adult worm. So egg will be oval in shape. They are colorless, no bile stain, and clear space between the segmented ovum and the eggshell. So this is the segmented ovum, and this is the eggshell. So there's a space between the segmented ovum and the eggshell. This space is a clear space. This is a clear space, and the outer sheath is filled by hyaline sheath. These are blastomeres. 4 to 8 blastomeres are present. So let's go to the interesting part, the life cycle of the Ancylostoma duodenale. So first, this is habitat in the jejunum. So in the jejunum, you have the adult worm. Adult worm will then copulate. Male and female worms will copulate, and there'll be eggs. Eggs will be laid. So the uterus will fill with eggs, and the eggs will be laid, and it goes out in the feces. Feces, when it goes out in the soil bare land, there is egg matures and embryonation happens, and end of this larva comes out. So hatching of the egg will cause rhabdiform larva. So in this rhabdiform larva will be formed, and then you'll have the filariform larva. So filariform larva is the infective stage. Again, this filariform larva can creep the vegetables and plants. So if they creep the vegetables and plants, if we eat without washing it, it'll go to GIT, intestine, and adult worm again goes to copulation, and this cycle goes on. Or else, how will it be like? It can penetrate our skin while walking in barefoot. This in the soil can penetrate our skin, go to the venules and lymphatic system, and they reach the vena cava. Vena cava leads to the right heart, right atrium, right ventricle, and then that from right ventricle using pulmonary artery, it reaches the lungs. From lungs, there is alveolar irritation which causes cough. So cough causes sputum. Sputum will be filled with lava. Again, if they spit, again it goes to bare land, or if they swallow it, again it goes to GIT, and GIT to intestine. So this is the cycle. It's one of those easy cycle.
Yeah, this is, if you want, just repeat what I said. If you want, you can take a screenshot of this. I'll display it. And this is the life cycle. Next, let's see the clinical features.
Now we're going to see about the clinical features of Ancylostoma duodenale. First, we'll be seeing about the ground itch. Ground itch will be the lava will give rise to severe itching at the site of penetration. So mostly in the palms or in the sole or any other body parts where the lava penetrates, there'll be intense itching. The site of penetration, they'll have very much itching. Second is the creeping eruption. So the creeping eruption is formed due to subcutaneous migration of the fillariform lava. So as like in a skin, when the movement of the fillariform lava will give you like when you take a needle and just make a scratch on your skin, you'll have reddish discoloration, and the area will be swollen, right? So like that, the movement of lava will give subcutaneous swelling. So this reddish itchy papillae along the path of the transfer bite. So the movement where the fillariform moves, there'll be reddy patches in it. So it's also called the lava current. The current where it goes, like current, their eruptions you see, that is lava currents. And third one is the respiratory complaints. So this enters the lungs. They cause bronchitis and pneumonitis. So these will produce a large amount of sputum. Sputum will contain lava. So so when you're testing, you have to give for examination. You have to give for fecal examination as well as sputum examination. These sputum will have lavas. And then bronchopneumonia, you will have the hepatization. So hepatization, what is hepatization? These are the solid hard mass,
So
so
be spongy, but due to this bronchopneumonia will become hard. Due to the hard consistency, you can, like, in a low grade fever and mild cough, hepatization, like, you can't hear the lung sounds, respiratory sounds will not be heard due to the hepatization in low grade fevers and mild coughs and all. So next is the most important, due to as a hookworm is a hook like structure that goes and binds the mucous membrane of the intestine, where it causes bleeding. Excessive bleeding will cause malnutrition plus iron deficiency anemia. There's a lot of bleeding, so due to this hookworm there'll all be a lot of bleeding. And due to the attachment of hookworm in the mucous membrane, this causes the epigastric pain. So this is about ankylostoma duodenale. Bye.